Hi, Dr. Josie here. What a lot of you may not know about me is that I was trained as a family physician. And in my current role, in my current life or my prior life, I did everything from helping women get pregnant. I delivered babies, 2 villages of babies. I looked after children. I was dual boarded in adolescent medicine. I looked after couples. I looked after older patients. I did it all. And my training was really designed so that I could be dropped into any small town community and pretty much take care of everybody in that community. While I was doing a lot of pediatrics, there were some, essential musts that I talked to my patients about. First of all, I would tell my patients that I wanted, to the best of their ability, to have all of my patients deliver their babies vaginally. I left the obstetrical world when we had a lot of women who actually wanted to book a cesarean section because they felt that they were too afraid of labor. And while that sounds convenient, number one, it's a major operative delivery, and number two, babies who are born vaginally, I know this sounds gross, but they drink in or they ingest a lot of mom's flora on the way out, and they immediately have an intestinal tract that's populated by lots and lots of bugs, and cesarean section babies don't get that. And so some of the recommendations I'm going to make is going to be more, it's going to be stronger in terms of the way a baby was born. So there are 7 tips for keeping your children's immune system or helping develop your children's immune system. Know that developing an immune system and getting sick is kind of like a job for children. They need to get sick because if they don't develop a good immune system. So you can't have them always in a bubble and not getting illnesses because that's really not good for them. They will never develop any kind of natural immunity. We would consider about 8 to 10 infections a year as being completely healthy and a good thing for all children to have. So don't let them live in a bubble because it's really not good for them. It is their body's job to get ill and develop an immune system. So that's the background, and now here are the tips. Number 1, if you just had a baby, breastfeed. Breastfeed, 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 because that is the best nutrition for a baby. And again, they will get some of the flora from mom in breastfeeding. So that's a very key. If you can't, don't worry about it. Make sure your child gets a probiotic. Number 2, expose your children to a lot of fresh fruits and vegetables. All fruits and vegetables have different ingredients that help the immune system. There's flavonoids, there's all sorts of nutrients, there's beta carotene, and all of these really do help with building an immune system. I used to tell my patients that it takes about 10 tries before you can actually claim that you don't like something. Give it to your child and see what happens. And then if they don't like something, do it in a different form. Try raw, try sauteed, try roasted. Try different versions, but don't make a big deal out of it, because if they don't like it, just move on and then try it again at some other time. But encourage them to try it, and that's a way to get them to like their fruits and vegetables, because fruits and vegetables are really important. Play in the dirt. You need to, and exercise. So because playing is a form of exercise as a family, because exercise does help the immune system, and it also sets a life pattern of staying healthy. It's really difficult for me to encourage my adult patients who don't have exercise and play and activity and movement as part of their everyday life to suddenly take that on. So expose it to your children really early, and you'll find that will build a good lifestyle habit for them moving forward. Number 3, if you look at the various supplements that are out there, I like to keep things very simple. I think that children should have a multivitamin because sometimes they don't eat all of their vegetables and sometimes they can't get all of their nutrition. And so that's a really good way for them to fill in the gaps. A probiotic is especially important for children who were born by cesarean section and don't breastfeed. But all children should have a good probiotic as well. Vitamin D, that's really important because we just, it is a hormone and we just don't make as much of it because we're trying to protect our children from cancer. So we lather them up with, sunscreen and UV protection, which is great, but it doesn't allow them to make their own vitamin D. So a vitamin D is a really important thing. Tip number 4, get lots of sleep. Children need a lot of sleep. And, at least 8 to 10 hours, and during adolescence, they may actually sleep half the day away, kind of like cats. That's fine. You want them to get their sleep. And remember that tip about exercise? The more they exercise, the more they get tired. The more they get tired, the more that they're likely to sleep. So that's really a key to getting plenty of sleep is going to really be helpful for boosting their immune system. The next thing that I would like to encourage all parents to do is don't smoke. If you do, please smoke outside and don't allow your children to have any exposure to secondhand smoke. Secondhand smoke causes a tremendous amount of damage, and it really lowers the immune system, and it can cause lung issues in children, and especially if your child is asthmatic, you really want to keep them away from secondhand smoke as much as you possibly can. The next thing is hand washing. So what I talk to children about is every child knows the little Mary had a little lamb. And if they put their hands under water, they don't actually even need soap because sometimes soap is too dry. But if they rub their hands, kind of like this, under warm water to the tune of Mary had a little lamb, little lamb, little lamb. Mary had a little lamb whose fleece was golden, so whatever that is, because I don't remember it. But that's a great way for them to have as much contact underwater as they possibly can to get the germs off, because it's really the rubbing and the contact and the running water that keeps their skin clean. The very last thing is something that might be hard for some of you moms, but when your children do get sick, please don't pressure your pediatrician or your family doctor to give your children antibiotics. The vast majority of what children get is they get virus infections. Antibiotics are medications that kill bacteria, not viruses. And remember my first tip, their immune system, it's their full-time job trying to build immunity. They need to get sick. So make sure that you keep their temperature down, you make sure that they get lots of fluids, they stay well hydrated, but an antibiotic is not necessary for the vast majority of illnesses. So when the doctor says they don't need an antibiotic, please believe them and don't run for an antibiotic because you may not be doing your child a favor. So that's kind of it. You do those steps and you can do the best job you possibly can, and you can let your babies and your children's immune system do the rest of the work, and then you don't have to be so concerned about how they're going to grow and develop. So if you have any questions, you know where to find me, and it's Dr. Josie Tenore. I'm with FreshSkin Medical Spa and Wellness Center.